Hello, my name is Dr. Paul Scheiwiller. I'm an anesthesiologist here at the Institute for Orthopedic Surgery. I'd like to talk to you today a little bit about anesthesia and nerve blocks for your total joint replacement. First off, my role as the anesthesiologist here at the Institute of Orthopedic Surgery is that I am directly responsible for all the anesthesia care that occurs here. I'll be visiting you each day on your day of surgery and including your day of surgery, and I'll be performing the nerve blocks. Many people ask, well, why do we even do nerve blocks? We do nerve blocks so that you'll wake up with less pain and you'll be more comfortable than you would be if you didn't have a block. You'll require less pain medicine. There's less chance for side effects, which include things like nausea, vomiting, respiratory depression, sleepiness, sedation, confusion. And one thing nobody likes is constipation. Oftentimes we say less is more, and quite simply I mean that if we use an anesthetic that employs a regional anesthetic technique or a block, you don't need as much anesthesia. This is especially good for our older patients because less anesthetic equals less side effects. You'll generally wake up quicker, have less chance of having a hangover, less chance of nausea, vomiting, and if you're not sick and nauseous, many times you can start eating and drinking much quicker. Many people ask, will I be receiving a nerve block? The surgeon will request the nerve block based on the procedure and your specific patients. The decision to have a nerve block is between you and your surgeon. So what I'd like to do is go over what you can expect on the day of your surgery regarding your anesthesia. After you enter the facility and check in, you'll be taken to the preoperative area. In the preoperative area, you'll have the opportunity to ask any question. Your anesthesia team will visit with you. We'll talk about our plan, and you'll be receiving your block in this area before your surgery in the preoperative area. There's two types of nerve blocks that are done at the Institute of Orthopedic Surgery. One is a single shot block, the second is a continuous block. A single shot block is very similar to the injection that you might receive at the dentist's office. Basically, they place medication next to the nerve, they inject it, they remove the needle, one shot, no addition of medicine, no subtraction of medicine. A continuous block is generally a very specialized block, generally done only by anesthesiologists. This is similar to a single shot block, other than we place a needle next to the nerve, we inject medication, then we slide a little tiny piece of plastic tubing that's about the size of a fishing line. We lay it next to that nerve, we remove the needle, we secure that little piece of fishing line underneath the skin, and we hook that up to a pump. The type of block we'll be doing is called a femoral nerve block. Femoral nerve is a very large nerve. It's about the size of about your ring finger. It runs down across through the groin and covers about 75 to 80% of the knee. So how will we do this block? First off, the best news is we'll be giving everybody some sedation through your IV before we get started. We'll be positioning on your back. You'll be laying flat. We're going to prep the area, which is generally the groin. We'll be using a ultrasonic machine, ultrasonic guidance, so that we can see the nerve. This is extremely helpful. So we'll be numbing up the skin, placing an ultrasonic probe, allows me to see the nerve, allows me to see underneath your skin. I'll be taking a specially designed block needle. I'll be placing that right next to the nerve with ultrasonic guidance. Once I'm next to that nerve, I'll either do one of two things. If you're receiving a single shot block, I'll be injecting local anesthetic around the nerve. Once I'm satisfied that medicine's gone around the nerve, I remove the needle and then we're done. If I'm doing a continuous block, I'll be placing medicine through a different needle, place that next to the nerve, inject the medicine. Once I'm satisfied the medicine surrounds the nerve, I slide a little tiny piece of plastic tubing, again about the size of a fishing line. I lay that next to the nerve, I remove that needle, we secure that to your skin, and that block is done. We then hook that up to a pump and it runs in for about 2 days, the medicine around the nerves. Once the block is completed, we'll be taking you back to the OR. Many times you have one of two plans moving forward. You'll either be going to sleep or we'll be doing a spinal anesthetic. It's important to remember that the blocks can take quite a while before they start working, as long as 45 minutes. Sometimes the blocks work very quickly, and your leg won't feel numb, it will just feel very strange. Once your surgery is completed, you'll be waking up. Many of you will notice that when you're in the recovery room, you still will have some discomfort. Many times this is in unblocked areas, which are behind the knee or the sides of your knees. It is important to remember that the pain is much less than it would have been, and if you are having discomfort in the recovery room, we're going to give you plenty of pain medicines to get you ahead of the game. couple things that are very important to remember is that anytime you think that you're going to get up and walk, it's very important that you call your nursing staff. Make sure you wait for them to arrive so that they can assist you safely so you can get around without falling. It is important to understand that you are at high risk for falling, and this risk remains for 6 to 8 weeks. The highest risk is in the first several days. We want to be very careful. We want you to help us to help you. Many of you are going to have a little button that you can push connected to your block. This is for if you need additional medicine. This is a good idea to push this if your physical therapist is coming around, or if you feel like you're getting a little bit behind with your block, you can push this button, give yourself an extra bolus of medicine to keep you a little bit more comfortable. The next thing I want to talk about is once you're done with your surgery and you're through the recovery room, you're going to be going to the overnight care unit. It's very important that once you get into the overnight care unit, it's important to understand we're going to do everything we can to try to control your pain, but we need your help. So it's very important that when you get there, nurses come around and offer you pain medicines. Please take the pain medicines. It's important that you keep up with your pain medicines. You don't want to fall behind. I always say it's easier to stay comfortable than it is to get comfortable. One thing that's important, we're going to do everything we can to keep the area clean and to prevent infection. You're going to be going home with a special knee scrubbing sponge. What I'd like you to do is before you come in for surgery, I'd like you to use that sponge after you use it on your knee. So wash your knee first, then before you throw away that sponge, I'd like you to wash your inguinal area, your groin area with this sponge. Make sure you rinse off very well, and then come right in on the morning of your surgery. We do this to try to minimize any chances of getting an infection. One thing that's very important is that if your surgery is approaching and you become ill, please give us a phone call. Let us know what's going on. We'll try to do what we can to assess you over the telephone. If we can't get a good handle on what's going on, we'll either bring you into the hospital and I'll take a look at you and evaluate you, or we'll send you into your family doctor and have them evaluate you. The important thing is we want you to be healthy on your day of surgery. If that's not the case, we may have to reschedule. Last slide we show is something that was done by a 3rd or 4th grade class. It's just, again, stressing to you, it's very important that when you're here in the hospital, you do not attempt to get up, walk around without help from your nursing staff. You are at risk for falling. Last thing we want to do is have you fall and complicate things even more. If you fall down and hurt your other leg or an arm, it's going to make things very complicated because you need these other 3 extremities working very well so that we can help heal up the one that's just had surgery. So I'd like to thank you all. Thank you very much for your attention, and I look forward to meeting you all when you come in for your surgeries.